a topic that is talked about is there a toxic culture in surgical training? You've recently, a couple of years, you've been a consultant, and I've worked with you, I think, 1 week when I was on upper GI, and I really enjoyed working with you. So from your experiences, or from what do you feel? Do you feel there is a toxic culture in surgical training?
I wouldn't say I experienced a toxic culture.
Okay.
Really at any point in my training. But that's not to say there isn't one.
Yeah.
Okay. Just because I haven't experienced it doesn't mean that others haven't. I know people who have.
Yeah.
Okay. And I know people who are very close to me who've experienced toxic cultures. Me personally, I experienced at times a challenging environment and a very stressful and tiring training program at times. There's no doubt about it. But then I chose a specialty which is known to be associated with that sort of environment. And I certainly worked with some, at times, somewhat challenging characters.
Yeah.
But I suspect I knew how to manage those relationships. But there's no doubt that toxicity exists and is happening on a day-to-day basis, even still. I suspect it's better than it was. I think the people who trained me, I think, certainly trained in a far more challenging environment when it comes to the individuals that they were working for.
Yes.
But I don't think there's ever necessarily been as challenging a time to be a junior doctor, and that's not because we're not. My seniors, and people I trained with, were working 120-hour weeks.
Yes.
Okay, but they weren't necessarily seeing 40 patients on SAU in 12 hours. Okay, and they weren't necessarily having to deal with the challenges of that surround you nowadays in big hospital trusts, and they had a surgical firm, which was like a family. And yes, it was hard. Yes, they got a pasting at times, but they probably felt, also, like it was worth it in a way, because they felt inclusive within this surgical family. And it's just a very different era. There's no doubt about it. There are so many other factors around at the moment. Not just junior doctor strikes, but all the other discussions that are going on in terms of the profession as a whole, and training programs and bottlenecks, and so all these things contribute to the overall experience of trainees. And so just because they're not doing a 1 and 2 on call doesn't mean that they're not finding it difficult. So, for me to sit here and say, I didn't necessarily experience malignancy or toxicity, is not to say that it's not happening at the moment.
Or improvements are still yet to be done.
There's definitely improvements still to be had. There's no doubt about it on a whole host of different levels. As individuals, all you can do is, I suppose, behave as you would expect others to behave for you, and try and call out toxic behaviour if and when you see it. And tell those individuals that it's no longer acceptable to behave like that. My training through the West Midlands, I had a very rich experience in a whole host of different hospitals. But my time as a more senior registrar was definitely challenging, and it was challenging because the patients we're looking after are very complex, and a lot was expected of us, you know. And if you add in the challenges of life and the, economical challenges and everything that comes with modern day training, long commutes, and then it all adds to the stresses and strains of surgical training. So it's important to have mentors that you can speak to, who can advise you. I'm incredibly lucky with the family I've got, and my wife Susan, who without whom there was no way I would have got through my surgical training at all. And I found it just so helpful to have her guiding me through, and as well as colleagues who supported me and could advise me on the decisions I was making in terms of the rest of my surgical training. So
okay, yeah. I guess, do you have any advice for juniors then who are interested in surgery, are interested in particular subspecialty? They were aware of the challenging situation that surgery is, and they will meet challenging people. What advice do you have for them?
I think, irrespective of what industry you work in, be it medicine, be it law, be it a private sector, you're always going to come up against challenging characters. You've got to just know how to deal with them, and I think you should feel able to call out behaviour which you feel is unacceptable, and just be very honest and say, actually, the way you spoke to me isn't acceptable. And it might have been acceptable at a point in time when you trained, but it's no longer acceptable. I think there are pathways out there to support you within the trusts that maybe previously didn't exist. Supervision, clinical and educational supervisors. Sometimes the problems with the educational supervisor, and then that's another tricky situation. But surgical tutors, freedom to speak up guardians. I think the piece of advice I would give surgical trainees is, it is just a job. As much as we love it, if something happened to me tomorrow, the operations would still get done.
Yes.
Okay. And the NHS is a big beast, and the wheel will, the world will continue to turn. And that's not to say you shouldn't try hard and want to be the best that you can be, but you need to put it into perspective, and it is just a job. And I think there are more important things out there, as an individual. And I love what I do. I love getting up in the morning, going to work. I love operating. I love my patients. But it's really important not to sacrifice other things in your life. Because, as I say, I think you find that you are replaceable, and that goes for anybody, I suspect, in the NHS. And it's really important to make the most of everything you can in life. And I think you get more out of work if you've got other aspects to your life where you can go and have downtime. And I think I've learnt that as I've gone later on in training, the importance of taking your annual leave.
Other interests, like hobbies,
absolutely, other interests, hobbies, spending time with family, spending time with friends, and just getting away from it, because it can be draining at times, and if you don't get away from it, that's when you start to resent it. I think, if you go away and you have a week and you come back refreshed, you're ready to go, and patients want a doctor or a surgeon who's refreshed and is enjoying their job, not with someone who's resentful and is burnt out. And as I say, there are so many factors at play nowadays in medicine that weren't there previously. And I do get a bit exasperated at times hearing retired doctors talking about how it was in their day, and and I tend to just let it wash over me, because otherwise I'd get a little bit worked up.